Allergy-induced ear infections. Could that be why your dog is scratching his ears and shaking his head? In this video, I'm going to be showing you the exact step-by-step ways to treat this and prevent this from happening at home. Allergy-induced ear infections in our dogs, they're very painful and they tend to recur. The allergies cause the skin barrier within the ear to break down. That leads to increased wax production, it allows yeast, it allows bacteria to overgrow secondarily. You've got otitis. You've got an ear infection. The signs and symptoms of allergy-induced ear infections, they're similar to otitis externa. Your dog is constantly shaking his head. He's scratching in here at the ears. When you tilt the ears back, you have a better look in the ear canal. It's often very red, all here at the external portion of the ear canal. Often you're going to see discharge coming out of the ear here. It's typically going to be painful anytime you palpate it or touch it. And in many of these dogs, this is chronic and ongoing. The ear canal actually gets really thickened. So it gets to the point where it's even difficult for you to see actually into your dog's ear canal. Most of these dogs with allergic otitis, they have generalized skin inflammation and irritation. So you can lift up your dog's rear leg, have a better look into their groin. You're going to see it's red and inflamed, except you see little pustules or bumps. And initially with many of these dogs, we see this seasonally. So when the seasonal allergies flare up, when things are all pollinating, generally that's when allergies are the worst. Typically then you see that coincide with an ear infection. So step one, you're going to treat the ear infection. This specific remedy, it starts with 60 mils or 1/4 cup of concentrated green tea. The green tea bag, it's sat in here for about 15 or 20 minutes, so it's concentrated and strong. Then to that, we are going to add apple cider vinegar. I'm going to be adding in 1 tablespoon of the apple cider vinegar to our 1/4 cup of concentrated green tea. Next, you're gonna get yourself a syringe. This here is a 20 ml syringe. Even a 3 ml syringe is fine. You're gonna draw a small amount up in your syringe. You're then gonna tilt your dog's ear back, tilt his head to the side so you can open up that ear canal. And you're gonna be putting 5 to 6 drops within the ear canal here. You're then gonna rub the base of the ear canal really well. You're gonna hear it work its way down that ear canal. You're going to be doing that twice a day. You're going to be doing that between 10 to 14 days. The green tea, it's antibacterial, also has some anti-inflammatory properties. The apple cider vinegar, it is antifungal as well as being antibacterial. The two of them together, they do a great job at treating most of the common causes of allergy-induced ear infections. They're going to deal with the yeast, they're going to deal with the most common bacteria, then thirdly, they can also decrease some of the inflammation. Another option to treat the ear infection involves this. Over-the-counter antifungal, this is Canesten. The most common cause of these allergy-induced ear infections, it is yeast. So typically in these dogs, you're gonna see a black waxy discharge. The ear smells a little bit sweet. Most likely that's a yeast ear infection. A human over-the-counter way to treat yeast involves Canesten. It uses the antifungal clotrimazole. And what you're doing is putting a small amount, about 1/4 inch, into your dog's ear. You're rubbing the base of the ear really well to work its way down. You're gonna do that twice a day, somewhere between 7 to 10 days. And that's gonna treat most of the dogs that have yeast, allergy-induced ear infections. Step 2, you need to deal with the underlying inflammation. The ears, they're typically really red, inflamed, and painful. We need to be giving something to decrease all that inflammation. I'm gonna give you 3 options. Number 1, I really like this licorice root extract. Licorice is considered the natural corticosteroid. It does a great job as decreasing inflammation, also counteracting the underlying allergy. A pretty typical dog dose is about 1/2 ml per 20 pounds of body weight. It's about to here. Tula is 20 pounds. Now I'd be giving that to her twice a day. I'd be doing that for 14 days. Licorice root, it's not meant for long-term use. It's meant for short-term use to decrease that inflammation, counteract the underlying allergy. So the maximum time you want to use it for is for 14 consecutive days. You also can consider this. This is 95% curcumin. Curcumin, it is a great anti-inflammatory. It can be really beneficial for dogs that have allergy-induced ear infections. The standard dog dose of the curcumin, 50 to 100 milligrams per 10 pounds of body weight daily. This is the bioavailable curcumin. It's 60 milligrams, but equates to about 250 milligrams of curcumin. So Tula's dose of this bioavailable curcumin will be 1 60 milligram capsule once a day. Another really effective anti-inflammatory orally and topically, it's this CBD. Cannabidiol. Standard CBD dose is about 3 milligrams per 10 pounds of body weight daily. Little Tula is 20 pounds. Each drop of my CBD is 3 milligrams. Her dose is 2 drops. That would be 6 milligrams once a day. CBD can be given orally like this. She really likes it this way. You can also use it topically. So one, it's a good anti-inflammatory. Secondarily, it also seems to help many of these dogs that have underlying allergies. So it's a really good option if you have a dog that has recurring ear infections, primary skin allergies. Step 3, this involves getting to the root cause. Here we're treating the primary allergy. First, you need some type of antihistamine. You can use a conventional one like this, cetirizine, or you can use something holistic and natural like this, nettle leaf. This is the brand Reactin, the name of the antihistamine, it's cetirizine. And this is the all natural organic nettle leaf. Cetirizine, it's a newer generation antihistamine. What's nice about it is it's non-drowsy. Secondarily, it can be given just once a day. The standard dog dose of the cetirizine is 0.5 milligram per pound, meaning a 10-pound dog gets 5 milligrams, which is half of a capsule. A 20-pound dog, which is Tula is, should be getting 10 milligrams, which is one of these capsules once a day. A good natural antihistamine is nettle. This is the nettle tea. If I were to dose Tula with the nettle, it would be about a half a cup of a concentrated bag of nettle tea. Let this sit and steep for about 20 minutes. Pour half of that cup into her water and she'd be getting that daily. So Tula would be getting about this amount. It's about a half a cup of the nettle tea once a day. Since your dog has adequate levels of these, this is the essential fatty acids in particular. This is krill. A standard krill dose of my supplement is 500 milligrams per 25 pounds of body weight daily. Tula gets 1 capsule once a day. And we're finding the best results if you use a good quality essential fatty acid supplement in combination with the antihistamines. You should also consider adding in this. This is bioactive quercetin. This is the flavonoid which is so beneficial for our dogs that have allergies, allergy-induced ear infections. It's an antioxidant. It's anti-inflammatory. It also seems to have specific properties that can help modulate this overactive immune system, which is what's triggering this allergy in the first place. This is 50 milligram bioactive quercetin. It's at least 40 times potentially better absorbed, meaning it has a much better chance to be far more effective. So typically I'd be dosing a 20-pound dog like Tula with 50 milligrams of the bioactive quercetin once a day. Then last but not least, consider this wonderful fat that's isolated from soy. It's beta-sitosterol. This is one of the few natural products that has been studied and shown to be effective for atopic dermatitis. That's environmental allergy, and that's the underlying cause which is causing these recurrent ear infections. So you've yet to consider something like beta-sitosterol, I encourage you to do so. It's very safe, minimal to no side effects, so it's a good option to consider trying. Each capsule of this has 150 milligrams of beta-sitosterol. Tula's dose would be about 75 milligrams twice a day. So what I would be doing is just giving her 1 capsule once a day of this plant sterol, which includes beta-sitosterol. But it's important that you give it for at least 4 weeks before you can assess whether it's going to be beneficial or not. So if your dog has skin allergies, secondary recurring ear infections, likely it's allergy-induced ear infections, go through those steps sequentially. Treat the ear infection, treat the inflammation. Third, treat the underlying allergy. You go through all those steps in a sequential basis, you have a really good chance then to holistically finally deal with your dog's recurring ear infection. Thanks so much for watching this edition of Veterinary Secrets of allergy-induced ear infections in our dogs. Click up there to subscribe, hit the bell sign for notifications, then you click that link directly in the box below. I can send you a copy of my free book.